participate us. So I'm ready to go.
Yeah, I think this thing's going good, and we'll take it any way these guys want it to go, and we'll kind of grow it and add things. And for everybody out there, you got to give us suggestions. You got to give us some feedback. You have to tell us how you want this to grow, because we want it to be an opportunity for you guys to come on and ask questions from people that do this for a living as professionals. And it's open. You know, we started topic, but we can move towards any directions. Let's get started. I think this week, Nicole kind of brought this to my attention. And I guess we're going to have to formalize it and kind of distill it, because it's a big topic. Really, what we want to talk about is marijuana and recovery. And I mean, you know, this could be meth, benzos, whatever, but I'm going to really kind of in my mind think about opiates. Okay, opiates and people in recovery. And what I noticed locally is recovery programs popping up, and homes, you know, like sober living homes popping up with allowing people to smoke marijuana. So that's sort of the topic today. And I don't know, let me open it to you, because I could just go on forever. And I even brought some notes, because I really want to distill this and formalize it and make a few points. But I'm going to open it up to you and see what your general thoughts are.
You got it. So what's up, everyone? I know this is more of a controversial topic in nature because of various point of views that exist. So I just want everyone to know that I'm going to talk in a general way. So I'm not talking about anything specific. I'm not talking about any one specific recovery program. There's no judgment here. Me and Dr. B, if you watch us in previous weeks, we're big advocates of whatever works for you, and it doesn't necessarily mean that works for another human being. All that being said, as you know, I am a licensed clinician. So I have a master's degree in marriage and family therapy. I'm a licensed advanced addictions counselor. So when I speak on a topic like marijuana, that's the framework that I'm going to be coming from. Okay, so I'm not coming from a 12-step abstinence program. I'm coming from clinical evidence data. I'm coming from clinical diagnosis. I'm coming for effective treatment outcomes and all that. So just bear in mind, keep that context as I speak. And, you know, I've already read some of the sidebar. There's people here talking about how marijuana has helped save their lives in their recovery. And there's people talking about how, due to the other addictions that they developed over time, when they would smoke marijuana, it would cause triggers in their anxiety and their paranoia. It wasn't the same anymore. So I get the whole spectrum. But when we're talking in regards to the recovery homes that Dr. B is talking about, in outpatient treatment facilities and all that kind of stuff like that, I'm a firm believer that when you are in care for substance use disorder, and mind you, substance use disorder, if you're wondering what that is, there's actually 11 criteria for how someone diagnoses someone with a substance use disorder. Okay, and if out of that criteria, if someone checks off 4, 5, 6 of those, a clinician like me can say this person has a severe substance use disorder. And let's just consider those individuals first. Those individuals, when they come into treatment, when they come into care, when they come into a sober environment, I strongly recommend and suggest that they stay away from all mind and mood altering substances, especially in the onset and in the first initial stages of treatment. Here's why. So let's just say you come in for opiates, as Dr. B was talking about, and an individual that comes in for opiates says, hey, I never had a problem with marijuana. I can still kind of engage with smoking marijuana and just be okay with it. And here's why I say in the initial stages of treatment, that's not a smart strategy to go about. And here's exactly why. So please listen to this. Is the more stressed out human beings are, the more we act out in addictive behaviors. Okay. So if I'm going through recovery, if I'm off of my drug of choice, and now I'm going through life, and all of a sudden I feel triggered, I feel stressed, my emotions start to heighten. And if I reach for the use of marijuana to calm myself down, to cope with that stress, right? I'm disabling myself to learn how to self-regulate my emotions on my own, to learn how to bring my anxiety down on my own, to use holistic methods, to use ways like breathing, talking therapy, working through my trauma, all that kind of stuff. So every time we have the ability to go back and smoke pot, we disable ourselves from actually working on the underlying stuff. It's really hard. And as a therapist, I'll tell you this, when someone comes in, even if they don't have a problem with a specific substance, the baseline recommendation is always, while you're going through the therapeutic process, you need to be abstinent from mind and mood altering substances. That's just, it's for effective treatment outcomes, because it allows us to actually get in the roots and get into to why we're there in the first place. So that's my basic premise on it. I'd love to hear individuals talk and give specifics about it, how it helps them, how it hurts them, and we'll go from there. This is really user driven, guys. We want to be a user driven option for you guys to be able to come share your thoughts, your philosophies, your ideas, and hear some really, really good clinical feedback from Dr. B, and hopefully something good for myself to help you in your recovery, whatever that looks like.
That's fantastic, Parham. Really well said, and it reminds me of some things that I need to point out here. And really, at the end of the day, let me repeat some of the things you say. I might go for a while here.
Okay.
I absolutely, it's important to note that I, like you, come from a professional clinical position, okay? And I, like you, in our endeavors in treatment, we're very harm reduction based, and we're non-judgmental and open to anything. Certainly for both of us, I think it's to the extent that we think it's not going to put you back. Well, if it's not going to kill you, but it might put you back, we'll educate you and we'll take it as it comes. So, 12 steps. Yeah, Parham made a great point. I'm not a 12-step person. That's not what I do for a living, but if that works for you, great. Now I want to go ahead and talk about this, and I agree with everything Parham said. And Parham, please chime in here if you have things to add on this. I keep looking at the screen where you're at, and I need to look at the thing. Sorry. But first of all, I want to point one thing out about marijuana as a the concept that, hey, this is a harm reduction thing, okay, and in recovery, okay. Let me point something out. We have to really, this is one of those topics that usually in American society, as most topics do, just get thrown in, terms get thrown around, and it all kind of gets bunched up into one pile of shit, okay? And it's misunderstood, abused, misused, and used because of our political economy, used for profit. So let's take a few things and really separate out. As people continue to decriminalize and some legalize, whatever, this point doesn't matter here, marijuana, that's a great, great step in terms of harm reduction. Why? Not because it's such a great therapeutic modality, we haven't even touched that yet, but because the consequences of keeping drugs illegal is just bombastic, okay? Sending a woman to jail with 2 kids because she's in the car with a boyfriend taking whatever, 100 pounds of marijuana across state lines. Now she's in federal prison for 40 years, and she was just trying to make rent, is not cool, okay? So in terms of harm reduction, shoot, I'm down with decriminalizing marijuana, heroin, and having places, injection sites. So absolutely, in terms of that, it is harm reduction, and that's a great thing, okay? Now, in terms of the way things go for us as a society, as usual, okay? I'd like to make an analysis, make a comparison, an analogy, and that's our history of war in the 20th century, okay? For the most part, most conflicts, and I'm not trying to offend anyone because this has nothing to do with the veterans. I have great respect and empathy and sympathy for the veterans. So this has nothing to do with the veterans. This has to do with the way our society and the systemic infrastructure of our social constructs and our view of the world. That's what I'm getting at. Most of the wars we engage in are complete nonsense, okay? And after the fact, the veterans are really left out to dry for their mental health needs and their issues that occur to them. And then the veterans, many of them are like, man, what the heck? The Uncle Sam left me out to dry and I served proudly. And the war, and then they realize it was nonsense. And yet we do it again, right? It just keeps happening. Like let's say the Iraq War and so forth. A lot of veterans came back with a lot of issues, PTSD, substance abuse, amputations, and then they're like, man, what the heck was that all about? Legalizing marijuana and drugs in the history of this country and how it's promoted by a for-profit industry, whether it's the pharmaceutical per se or other industries, is the same thing. If you go back to opiates, when the first time it was, when they isolated opium from, when they isolated morphine from the opium poppy, and that is the most active addictive substance in there, right? As well as being something that gets you high. The Merck pharmaceutical, early 18th century, sold it as a treatment for opium addiction. And it was actually the most addictive thing in the opium poppy seed, right? And the guy who actually isolated was really bummed out about this fact. And then we had the Civil War, and then we had soldier's disease, which was all these guys that became addicted to morphine. And this goes on and on with the amphetamines, and then eventually back again to the opiate epidemic and doctors pushing, painkillers. And then we go back and say, oh, okay, that wasn't the case. Now, if you look at it when it's not medically industrialized, we got kratom and we have marijuana, okay? They're pushing this stuff without the data. And when I say marijuana, in this case, I mean the cannabinoids and the THC. It's tetra-9, delta-9, and, that's the one that's active and so forth. If you look at it, it's being pushed for everything, and these shops are kind of selling it as the cure-all for every single thing you can imagine. And then we're going to go back and look as the data is coming out, more emergency department visits, more, and this is not the same marijuana as before and so forth. So I'm just saying this in general. So you're going to get all the backlash in the next 20 years, okay? Now let's get down to when we're saying marijuana pot. Look, this is such a, we are going to keep this discussion not for pain, not for your anxiety, not for your sleep, not for your depression, not for your multiple sclerosis spasticity. The list keeps getting longer. And we're going to talk about the stuff these guys are using. And we're going to talk about a very specific group. And it should even be cut down even more. It should really be, let's say, males 18 to 45 that have a heroin problem, that are using this very particular constituent of the cannabis plant. That's what the discussion should be. But not having that, we're going to keep it to the group that is in recovery for. Sorry, I am trying to. We are going to keep it to the group that is in recovery, so we don't get all kinds of questions and backlash coming for this is great for my pain, et cetera, et cetera, et cetera. Now that group in recovery, Parham nailed it absolutely and completely. And I see all these homes popping up, and these guys have no idea what they're talking about. There's no data that shows for this particular group, this is a viable method, right? There's no solid data coming out that this is a viable long-term method for recovery and abstinence. And in fact, there's a lot of data about the potential long-term effects on the reward circuitry and addiction with the sort of marijuana that's out there nowadays, and I use that term loosely, but I've already described what I'm going to talk about. And everything Parham said is absolutely true. And I see it as another marketing scheme that we suffer from. It is not formal thinking. And then finally, my own personal experience with this group of the population. Okay, hardcore heroin addicts that I deal with. I can say this, and it took me a while to get this. I have never, and I can say this is anecdotal, but it's my clinical experience with dozens of folks. And I have some that I'm struggling with. I have never seen anyone either A, remain sober off the harder stuff, and or B, move forward in their long-term growth, maturity, and recovery when they continue to smoke marijuana within that population. And every single one, when we finally got to the point of get off, and a lot of these are outpatient office patients, so I don't control them using, but the ones in the house, I've had cases where they've been off of heroin, let's say for 5 months now. They were homeless before that, and I can't get them to stop marijuana. And I'm like, hey, you are going to get kicked out of intensive outpatient treatment because our sober living homes and our treatment program is not okay with that. And their argument is, I needed to wake up. I needed to go to work. I needed to function. And one day you start to sit and think, or like, isn't that addiction? And then they give everything up for smoking marijuana. I would say that's addiction. And the ones that quit really progressed and moved forward. So I was trying to really make some positive validated comments about marijuana. I wanted to really scope and hone in on this group that you're talking about, which I agree with everything you said. And I wanted to really point out the fact that marketing and our political economy comes into play here like it has with everything else. I mean, we have a Kratom advocacy group making clinical arguments about Kratom. And this is not to say that there are people out there that it works for, but that doesn't mean it's good. This is what people have to understand. This is what statistics, probability, and clinical evidence means. It might work for 10% of the population, but that doesn't mean this is a validated treatment modality to stay sober or clean. And I just wanted to introduce it with that. I hope I didn't confuse people, but that's what I have to say, Parham, about it.
Yeah, that was wonderful, man. I mean, I know we're agreeing with each other here, but it's just building on the points that we need to be talking about here. So again, this talk primarily is for people that are trying to get off of drugs. Like, drugs has caused consequences in their life, and they continue using substances despite of those negative consequences. They're unable to regulate their emotions. They're having, financial, emotional, relationship problems in their lives. They're seeking treatment to say, I need help with my drug use. These are the type of people that we really want to hone in on right now. If you've never sought treatment and you use pot, like Doctor was talking about, for a variety of reasons, and it's working for you, that's not the same type of pot that we're talking about. Because the other thing too, be wary of any treatment center or any sober living that allows you to smoke marijuana in that facility. Here's why. There's a high probability that those individuals are also there for co-occurring disorders like we call, PTSD, anxiety, depression. There is a high probability that they're on medication for those, and those might be even prescribed by a doctor. There are interactions that marijuana makes with those medications that has negative consequences. It doesn't allow us to learn how to self-regulate our emotions like we talked about. And if somebody says, hey, when you're feeling, sad or triggered, go smoke some pot to feel good, that means that person isn't really in it for the right reasons for your well-being. They don't really care if you actually heal, work through your trauma. They're just saying, as long as you smoke pot and show up to our facility, we're good. And that's the marketing scheme the doctor's talking about over there. So be wary of all those. And the other thing, 2 points real quick while we open it up to some people. There's some good conversations going on. 2 things about the, we're talking about marijuana being harm reduction, and then we got to look at the United States as a whole as a map. There are still parts in this country that smoking marijuana, having marijuana is a felony, right? So when you have pot in your pocket and you get arrested a few times, you can get your third strike and go to prison for life for the same pot that we're talking so casually here on the West Coast or from any other of the states that got legalized in the past few years. So let's please put that into consideration also. And the last one too is about, the criminalization of this thing. I'm like you, doctor. I'm very, very committed to the recovery space and all that kind of stuff. And I really do it for altruistic reasons, but I do believe that we need to decriminalize that specifically. And the amount of, there's no lie about this. Go to the Department of Justice, my friends. Go look at the statistics over there. The United States, we make up about 5% of the world's population. We house 25% of the world's inmates. 5% of the world's population houses 25% of the world's inmates. 1 out of every 4 people in the world behind bars is behind bars in the United States, more than Russia and China combined. And I say this because as a recovering individual with about 13 years of sobriety, I'm no different than those people. If I didn't have the ability, the intervention methods, the family support, the insurance to be able to go seek treatment, find treatment, I would have been shuffled in that same criminal justice system. There is no difference. The line is really, really thin. And I don't think that's the way we should be treating people like us, the recovering community, to go lock them up behind bars. And there was a veteran here that actually agreed with what you said. I also want to support our veterans in this comment is the amount of, he identified with having complex post-traumatic stress disorder since returning from service. The amount of veterans, this is a real statistic, my friends, that have committed suicide on United States ground since coming back is more than the total amount of human beings, veterans that died in Afghanistan and Iraq combined. More people have died in America, veterans, than in active duty of those 2 wars combined. Every 22 hours, one veteran takes his life or her life with suicide. So, yeah.
No, go ahead, please.
No, go for it, man. That's all I had. Yeah.
You said a bunch of stuff, and we'll get to questions. But the last thing you said, you brought up the veterans thing. Look, I've spent time working at the Long Beach VA during my training, and I was actually at one point competing for the job as the ER, the emergency department medical director. But I absolutely have always loved that population. There's a degree of kindred spiritude that I have with them. I just dig on these people. They're just good people. And I recall walking into Wahoo's, and I couldn't believe my eyes watching on TV. I think what did they call it? It was like a video game, Flash and Awe, or Bush was calling as the bombs were destroying Iraq, and they were showing all these paratroopers and stuff going in. And I remember I had 2 thoughts. One was, oh my God, these people are all just sitting here with their kids eating food and talking about the baseball game while there is enough ammunition to destroy the parts of the early, the world just being dropped on humans. And all these guys are probably scared and going into this battle, both sides. And the second thought I had was, these poor military personnel, and especially the enlisted, this is going to go on forever. And it's going to make the Vietnam post, PTSD, all the substance abuse, it's going to make that look like a joke. There's going to be so many of them. And in fact, right now I'm trying to work with TRICARE stuff. I really want to get back with these people. So that's that. One other thing I want to point out, sorry. Although emergency department visits and admission to treatment centers for marijuana addiction and emergent issues, mainly psychosis, are increasing, the data shows adult attitudes towards marijuana for their kids and its negative consequences are getting better. There's a inverse relationship, which means this, because this population, my age and so forth, all probably grew up smoking pot. this is going to continue to be an intergenerational issue with a lot of problems. So I'll turn it over to, oh, there's somebody there. Sorry. Should we bring on Isaac?
Let's bring him on.
Have you been following the questions? I'm not. Are you able to pull them up? Let's get Isaac on.
I don't know how to pull them up, but I'm reading them, though. A lot of really good feedback.
Okay. Isaac, we can't see you, and that's okay if you don't want to, but we'd love to see you. Hello? I think your microphone might be mute, Isaac. Let's give Isaac a minute here to
Okay.
see if there's any issues, and then we'll move on. Isaac, should we take you off and bring you back? Wonder if he took a break here. Okay. Isaac, I'm going to remove you here and bring you back when you get on. Hopefully you get on. Guys on TikTok, please remember we are on Dr. B Addiction Recovery with Master's Level Substance Abuse Counselor Parham. We're here every Sunday. I keep it going on the TikTok, but get on the channel on YouTube, and you can come on and ask us questions. It's done really well, and we're here. Okay, Isaac, I'm going to remove you and add Cindy, who looks familiar. I'm not sure why. Okay. Okay, Cindy. Why does Cindy look familiar? Hi, Cindy.
Hey, Dr. B. How are you?
Good. How come you look familiar, Dad?
I'm from Tattoo Fam on TikTok. We've got scheduled a visit to come see you in California.
Oh, yeah.
In April. Looking forward to that.
Okay.
But first of all, I'd like to say thank you so much for bringing up the topic of complex post-traumatic stress syndrome. That's not something you hear very often. It's not something people talk about very often. And as a military veteran who did not serve 20 years, I came with a comorbidity, childhood trauma mixed with the trauma of being in the military and seeing and doing the things that I do. This is a very vulnerable position because it's the first time I've spoken this on a public platform. Mostly talk about my husband's addiction. But I white knuckle life. I don't and haven't had treatment for my complex post-traumatic stress syndrome other than, cognitive type therapies and things of that nature. However, I am very interested to hear what y'all's opinion is on medicated treatment for someone like myself, who quite frankly could be a ticking time bomb. When you deal with complex post-traumatic stress syndrome, there's a whole lot of different mental disorders that come with that diagnosis. I was properly diagnosed. I did go through the testing, so I do know for sure that is what I have. But for someone who has been unfortunately exposed to the non-medical treatment, abstinence is the way, my faith and all of those things combined. What do you guys suggest for someone who is white knuckling complex post-traumatic stress syndrome? And what is your opinion on medically treated with medication for someone who could potentially struggle with more of those issues in the future?
Parham's going to do, I'm going to let Parham take the lead, and I have got a bit to say, but he's amazing. I just have one question. What do you mean medication? You mean psychotropics?
Correct. For example, I was prescribed 0.5 milligrams of Xanax, which quite frankly worked in the beginning. But as my CPTSD has progressed over the years and over time, doctors have not been willing to increase my dosage whatsoever out of fear of addiction because of the complexity of my diagnosis. Therefore, that's what I get. I get 0.5 milligrams of Xanax and told that this is all that I can have based on the potential addiction properties of was it a benzo? or
Yeah.
whatever.
Xanax, yeah. This is great, and Parham is amazing at this. And in digging in, I'm going to let him take off, and I will add because I do have quite a bit to say here. But Parham, please give us feedback. Cindy's great, by the way. She's going to be coming out to see me from Texas, I think, in a couple of weeks, and I think they're sticking around for 4 days. And her husband's coming out, and I hope to solve some of their issues, but it looks like I might be bringing her on as well because I have a lot to say. But Parham, please take off.
Sure. Cindy, thank you for sharing that on such a public forum, and also thank you for your service. Absolutely. I know me and Dr. B both appreciate and respect you for all you've done and for actually the contribution you're making right now, because it takes a lot of courage, and courage is always taking action despite a fear, right? I mean, that's why we celebrate courage in certain individuals. And thank you for taking action despite a fear. So complex post-traumatic stress disorder is what you're referring to here. If anybody doesn't know, is it manifests in multiple different ways. And I know it shows up in different ways in your life. And sometimes you know the triggers, and sometimes you unfortunately don't know the triggers. And sometimes you know what you need to do in a certain situation, and sometimes you get overwhelmed and your capacity to self-regulate your emotions is just not there. And it's confusing. It sometimes could be scary, obviously. And the beauty of it is that there are stages when it comes to treatment that can be taken in a specific order in order to kind of get a better outcome. So when you say your complex post-traumatic stress disorder started in childhood, I know that is completely separate than what you experience in active duty, correct? So as you have started to take this journey on, and how long have you been conscious of your diagnosis? How long have you been knowing your diagnosis? What have you done? Yeah, what have you done for it in terms of your recovery process? And I can kind of guide you from there.
That's a great question. So I was formally diagnosed in about 2016.
Okay.
I knew something was wrong well before that, but I wasn't sure what it was. Kind of thought sometimes I was going crazy. There was even talk about possible menopause at 30 years old. It was really very confusing. Doctors really struggled with the actual diagnosis of complex post-traumatic stress syndrome. Some of the doctors had me I had 30 different diagnoses. I was fortunate in the sense of finding a psychologist who was able to do the proper testing to get me diagnosed. So I've known the actual diagnosis since about 2015, 2016. The route that I was taken was cognitive therapy, exposure therapy. With complex post-traumatic stress syndrome, it is a complex, a chronic. I've re-exposed myself to trauma over and over and over and over. Now, because I have multiple types of PTSD, that's where the complex comes in. You've got a totally separate childhood trauma mixed with the trauma of the things that I've seen and done in the military. So that's when I was diagnosed. I've done cognitive therapies, a lot of paperwork, which for me is extremely overwhelming. There was a lot of paperwork testing, and that would overwhelm me very, very quickly. I was prescribed a couple of antidepressants to try to help refire the serotonin in my brain, which some of those, quite frankly, made me zombie-ish. So experimenting with those for me was very, very traumatic and scary because of the lack of control. And I'm sure, as you know, as doctors, with my condition, the feeling out of control, a zombie-ish feeling, was quite spooky to me. Now, they then prescribed me the Xanax, in which it did work. It was the one time in my life in which I truly felt normal. I didn't feel like I was in my head all of the time. However, as my trauma progressed, and triggers, like you said, sometimes I wouldn't even know what they were. I started to have and was diagnosed then with panic disorder. It was generalized panic disorder. And I would have a panic attack going to Walmart, and I wouldn't even know why. When I addressed this with my doctor, the concern was that it's addicting. We can't increase your dosage. That's too scary for us. With your type of mental health disorder, this could be a severe addiction or whatever. I just never could get them to come off of anything else other than 0.5 milligrams of Xanax and or an antidepressant. And this is multiple doctors that I had conversation with. I mean, it came to a point where like living in my skin became so uncomfortable. I negotiated with myself often to take more than what was prescribed. And that was also a trigger, you know, because I'm not the rule breaker, so to speak. Do you know what I mean? But I also have recognized that the worse that my symptoms get, the more that I want to hit the switch and just say, forget it. You know, if a doctor is not willing to help me, and if this seems to be helping, but they're not willing to do it out of fear of whatever it is, like, I don't know. I feel like my hands are tied. So what else do? You start thinking of alternative methods. And to me, that is more dangerous than actually prescribing me what I need. But I don't know. I'm not a doctor.
Yeah, let me, I'm going to pass it, Dr. B, in a second, but therapeutically, so ever since the 2016 diagnosis, it sounds like you did a little cognitive behavior therapy in regards to, was it with a trauma specialist?
Yeah, with a trauma specialist, and they also did exposure therapy.
Okay. Yeah, so and what was the consistency of that? How long, since it's been 5 years since you have known the diagnosis, how long have you worked with it therapeutically, not with medication, the component of just the clinical piece?
2.5 years consistently.
2.5 years?
Of cognitive therapy and talk therapy and the exposure therapy. I did very consistent on a weekly basis. And quite frankly, I just gave up on it. Like, how I can only talk so much about the same thing over and over and over before it almost becomes a little bit re-traumatizing.
I understand that. And I actually have a lot of empathy for that last statement that you talked about. You know, just going through the process becomes traumatizing in itself. However, there's this really simple metaphor that I love. It's, you know, when they asked Dr. Wayne Dyer, you know, if you squeeze an orange, right, what comes out? And the answer is orange juice, right? And if you squeeze Cindy, what comes out? And it's all that stuff that you have inside of you. Because when you're talking about complex, going back to childhood, maybe the need to keep sharing and keep talking about it and keep squeezing and keep getting deep into the roots, maybe it's still there, you know, maybe as a possibility. Because just because we do something and expecting to heal or get better from it, but we haven't gotten there, doesn't mean that the continued treatment with the right providers, with the right clinical team, with the right physician, with the right, you know, medical oversight, with all that kind of stuff, doesn't mean it can't get us to a better outcome. So there are different modalities for trauma, by the way. You know, it's EMDR is a route that people go through for trauma. It's not for everyone, but it has been proven to work with individuals with complex trauma. Talk therapy, as you said, I know it gets to the point of getting exhausting. I know it gets to the point of getting overwhelming, and there's a lot of emotions that keep coming up with it. But talk therapy over an extended period of time does help with these things. It's just a matter of consistency over time. You know, when you got to the point of your symptoms coming up and you're having panic attacks going to Walmart and you just want something else to make you feel just a little bit better, to give you that relief, and not being able to get that from a provider to have this honest discussion that you're having, because you speak really well. You're able to talk about your symptoms really well. You're able to advocate for yourself really well. So then my question becomes, who's the provider you're talking to, and why are they not hearing you?
Yeah, I'm sorry. Go ahead. I was thinking the same thing.
Why are they not hearing you? Because you're not talking like someone that's seeking medication to be able to feel better. You're trying to, you know, feel better, like, you know, chasing that the high feeling. You're trying to feel better so you can actually function. And those conversations with the right providers have completely different outcomes than you're experiencing. So that being said, I do have a doctor here on my left-hand side that understands what you're talking about and can probably give you some practical clinical feedback of what that conversation is supposed to look like and feel like. But yeah, for my suggestion, Cindy, is just keep swimming, man. You got to keep moving forward. It's you've come from a long journey, and you've had a lot of trauma thrown your way. Some, you know, then and there, and some more recent. But you know, sometimes it just takes that much more consistent effort over time to get out of it. You know, you've gone through it.
Yeah. I'll be quick because I guess I'm going to actually see you soon. So let me separate a few things here. Number one, yeah, that is pretty badass that you came on here and you're extremely eloquent and you communicate the issue beautifully. Here's, I think, what the issue is. Number one, everybody keep in mind, I'm not a psychologist and I'm not even a psychiatrist, okay? I do addiction to the extent I should be understanding this stuff. And my background is emergency medicine, trauma, all that stuff. So take it with a grain of salt if you want to. What we're discussing here in terms of the mental health part of it is my thoughts on it is, now you're right, there's complex and there's PTSD. This makes it so much more diluted. My suspicion, and from what I've seen out there, is most of these guys don't understand complex PTSD, don't even understand the theoretical discussions that are going on about it at this time. Because, many people, it's a question of what is the relationship and to what extent does it lend itself to personality disorders, mainly cluster P, or even, the schizoid type and so forth. What are the clinical presentations? Well, I'll tell you, in your case, it's not an issue of depression. I can tell you this clinically. It's not an issue of depression. It's not an issue of anxiety. It's not an issue of panic attack. I'm going to call it, and I'll do it with confidence if I really was able to talk to you and make sure that this is what it is. It's neurosis. The classical neurosis described over 100 years ago in the psychology world. They say, well, what is that? I don't know. Bouts of depression, bouts of anxiety, bouts of derealization and depersonalization, and it's just very complex. If I was going to dumb it down for my world, I would call it panic, anxiety, depression syndrome. Okay, so it's complex, and you need the right person. And like Parham said, this is a thing where you got to kind of keep going. Now let's really quick move to the medication side. I think there's a cookie cutter approach from our side to all these medication issues. I don't know if you have a substance abuse history, but I will say this. It's not about, in fact, by accident, if everything you're saying is the case, by accident, I think the provider did the right thing by not giving you more Xanax, by accident. And what I mean by accident, I used to have a saying from one of my mentors in training and in teaching residents. The outcome of what happens after your clinical decision doesn't matter. Oftentimes we'd have M&Ms because, you would do something and a patient would die. These are very critical situations. It's the reason that you did it matters. And here's what I mean. By accident, he's not giving you more Xanax, but the reasoning is wrong, right? To say you have and so here's the answer. I think you need a very, very detailed look at your clinical presentation, very close follow-up of the medication regimens you're on. Some of it would be trial and error, and there might be a sprinkle of Xanax in there, because that's the worst thing to just use as the one-shot solution for this. And once that cornerstone is achieved, or while that's achieved, you need to get everything Parham said. But by accident, I think it's good that he's not giving you the Xanax, because I don't think increasing the dose and just letting it go without what Parham is saying is going to achieve longer. Things are going to potentially get worse, and the stress level will rise, and then your Xanax will rise. So if someone is going to give you Xanax, it needs to be there's many different ways to do it, and then you got to keep a close track of the patient and provide therapeutic support within the scope of your knowledge and understanding. And some of that is education for Cindy. Hey, Cindy, this stuff hits the brain really quick. I'm going to only give you 10 a month. We're going to use this as a baseline medication, this other thing. And then we're going to use this other thing to see if we achieve this thing. Meanwhile, you need to get started with Parham's people, and let's follow this closely, and let's follow these symptoms. Sleep, number of anxiety, how much anxiety there is, number of panic attacks, suicidal ideations, feeling paranoid. So that's how I would do it. And it's work. So I'll leave it at that. And I hope that helps. And thank you for coming on and sharing with us.
Thank you all so much. I appreciate bringing awareness to this, especially with our military veterans. Sometimes one poor choice away from sitting on the other side and needing you for a different reason.
We will chat some more about this. Okay, I think I'm going to see you right soon.
Yes, we'll see you soon. Thank you.
Bye.
Bye.
Okay, we got Isaac. Isaac, thanks for waiting, buddy. I'm sorry we couldn't get you on. You were here he is. Oh, sorry I couldn't get you on, Isaac. You were I don't know what it was. I'm not a computer guy, but I'm glad we have you.
It's quite all right. My mom actually called me and needed help with a stray dog. And I came back and was like, oh no, I missed my chance.
Isaac, are you from North Carolina?
Originally, yes. I've been in Las Vegas for the last 15 years and recently moved back.
Okay. All right, please go ahead.
I actually messaged you on TikTok earlier. I've had a similar situation. I've had an alprazolam prescription for 10 years. When I first got the prescription, I was also prescribed an SSRI. And before I would even take let me start here. Before I would ever even take the medication, I started reading books from Barnes and Nobles on anxiety and so forth. And I started exercising, and I had a very demanding job. I was the director of VIP services for Wynn and Encore Resort. And after a while, just the stress and the anxiety got so bad that I ended up leaving that position and going to another position within the company. And I finally had anxiety that didn't go away for like 48 hours, ended up seeking medical help for it. It was nothing severe. It was severe for me, but I just went to a quick care, and they wrote me a small prescription of Xanax, and they wrote me a prescription for 1 milligram pills, gave me like 10 of them, and told me to go see a general practitioner if it worked, for long-term help. So I was like, okay. So I started taking it. I took the 1 milligram, and it immediately zonked me out when I took it. So from that, I was like, well, I can't take that much. I would never be able to work on this. So I broke the pill into 4 pieces and started taking 1/4 milligram pieces. And for about, I'd say 1.5 to 2 years, I worked at one of the biggest nightclubs in the world, serving drinks to 5,000 plus people. And I would take a 1/4 milligram like before my shift. And it would work. And eventually, one night, I just forgot to take it. And I was fine. So when that happened, I was like, all right, I'm good. I'll just take it whenever I need it. So that became the last 6-7 years of I might not take it for 3 months. And sometimes I might have to take it 2 or 3 times in a week. But it just kind of like is with me. And if I have a responsibility and I feel that way, I'll take it. And that's kind of how I've used it. Well, of course, this pandemic has caused us all a lot of stress. And as you know, I'm in North Carolina now. I've had to give up a lot of belongings because of it. As you know, working in nightlife, I completely lost my job. I could have went to Miami, but I opted to go my own route. So now I own an online business and I'm running that. But anyway, the more important thing is for the last year, I've been using alprazolam daily at around 0.75 a day. So 0.25, 2 to 3 times a day. And right now I use it twice a day. And the biggest question is I sometimes don't even feel like I need it, but because I've learned about the withdrawal symptoms such as seizures and stuff like that, sometimes I've got responsibilities I've got to do, and I've got to drive to another state or whatever, or something like that. And I'm like, the last thing I want to happen is to have a seizure while I'm driving and hurt somebody else or blah, 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 any kind of responsibility, you name it. But it's the fear of like, well, what if that happens? Like, it's been 18 hours since I took something. Is this going to happen if I just try it and try to just stop taking it? Hope that made sense.
Yeah, not very nice presentation. Should I go ahead, Parham?
Yeah, I do have a few things to say, but since majority of it was related to medication, I prefer for you to go first.
Yeah, thank you. So I'm not going to get into the other parts. I'll let Parham, but my questions are, you said like the other case, I want to know if there's any background and history in CPTSD or PTSD or any psych diagnosis from before. But I'm going to leave that and just really quickly address purely the medication thing. So for everyone out there, this is not medical advice. I would have to really dig into Isaac to give, I try to give general responses about general concepts, and that goes for you too, Isaac. This is not a medical advice thing, okay? It
Understood.
never is on this channel from either one of us. Because again, I talk to you 45 minutes before I have any thoughts. But in general, let me answer the first question. Seizures and the bad stuff doesn't happen by you missing 1.25 dose, okay? Not at all, okay? So you shouldn't have to worry about that. In fact, that's how you want to explore, can I cut down? And it'll be, I won't say a couple of days, sometimes 2 to 5 days. But so you don't got to worry about that. It doesn't happen. Oh my God, I missed my dose. I'm going to have a seizure, but I feel okay. Especially if you feel okay, right? There's no concern for seizure. That is an escalation of symptoms, just like alcohol withdrawal, right? If you miss a drink, you're not worried about having a seizure. And if you feel okay. Now, when you're doing this with alcohol, which is basically the same as benzos are alcohol in the pill. Now you're moving towards a seizure with increased vital signs and all the symptoms. So that's that. As far as I will make a general comment. This is you are someone that without knowing anything else, just what you told me. Let's say everything else, all else being equal, one would think would have a very low abuse potential given the fact how long they've used it. But this brings out the very thing Parham and I are always, I think, trying to push. Look, you are using a medication that does have a high abuse potential, especially Xanax. There might be other things here that were never addressed and discussed that could have been addressed with therapy and more sober-minded medication regimen. And here you are years later in a position where, as Parham said, stress and shitty life happens. And the goal for us is to be able to cope with it without, sometimes we can use medications, but without using medication that can lead to abuse and potential for increasing it. And that's kind of what's happened to you, right? It became more regular after years of using it in a very sober-minded way. Keep that in mind. Now the question becomes, well, what do you want to do? If you want to stay on medication, I would do an assessment to see how many panic attacks you're having, what's your baseline anxiety. But I would do a cross tolerance to something longer acting with lower abuse potential to keep a baseline level for you throughout the day. And for the moment, I might sprinkle it with weekly, very few number of Xanax to see where we're at, and then get that off. Use a very low dose, less abusive potential medication, and discuss where we're going with that. Do we want to get off of that as well and continue with mental health? And that's how I would do it. Now, if you're just going to be tapering off on your own, it's dangerous for me to give advice. I would, and I don't want to give advice but I would just say if I was kind of doing it on my own and there was no other medical issues and there was no panic and so forth, I would cut it down, by maybe, your 0.75. I would cut those in half. First, make those a half a pill, the third dose, and then start going down. But it's really dangerous, and I'm not withholding information from you, Isaac. It's just not professional for me to really give that kind of advice, and it can be dangerous, and it's unethical. But in general, that is my thought. Cross-tolerance, finding better medication, looking at your abuse potential, and getting mental health help.
Thank you.
And for me, Isaac, I probably ran across you back in the Win days, I'm assuming, at some point before my old life.
Maybe.
You were Maybe there, right? But I'll tell you this. So when you tell me that a long time ago in your history, at least, you were prescribed some type of benzos and an SSRI for your depression, that tells me that the root of everything you've experienced in your life, at that point, there was a reason why you sought out and got those medications. So you're probably feeling anxious. You're probably going through some depression. And the odd thing here, it's not odd, it's interesting that you chose a field to be in that you're constantly around human beings. You know, you're constantly busy. You got 5,000 people in a place and this and that. And you're able to go months at a time without it. Because I'll tell you this, the more we actually engage with other people and do things, right, and we just get caught up in that doing act, the less we actually sometimes feel our symptoms. But what happened to you is when COVID happened, you went cross country, you're in North Carolina, I'm assuming maybe your childhood home, and you're back over there. And all of a sudden you stand still. All of those same things that you had originally within you, that originally caused you to go take the Xanax and the SSRI, all that stuff is starting to bubble up. And all that stuff is starting to bubble up. So therapeutically, if you want to know where to go out to help you with the titration off getting off of Xanax, if that's your route, the therapeutic work would be to find out what little Isaac was going through then and there. Because I promise you this, even though a bunch of time's gone by and you've had all these different careers and this and that, a lot of that stuff is still inside you, man. And you got to find out what that is, where it came from, how it impacts you. And the more you process that stuff out, and yes, as adults, we can process things that happen to us in adolescence and childhood. We really can. The more you process that out, the less you'll actually have that anxious disposition, the less you'll have that depression when you're just by yourself. Because there's one thing, man, I always talk about this. There's a difference between a human doing and a human being. Isaac, for a long period of time, was a human doing, man. And I know Vegas is a whole different world. You were constantly out of your head. You were constantly doing things till like 4, 5, 6 in the morning, man. And now you're just at home doing an online business, back home, and you're just being. What do you think's going to come up? All that stuff's coming up.
It actually sorry to interrupt, but it actually is not like that.
Sure, man.
I actually did have anxiety when I worked in the nightclubs, and the anxiety has actually gotten better stepping away.
Good.
So I'm always in my head. That's my personality type. And sometimes those thoughts are dangerous and not to my benefit, but a lot of times they are, and that's why I've been successful in my life. But yeah, for me, I really feel like, just to address what both of you said, knowing that I just haven't really been able to have an answer. The psychiatrist that I got when I moved to North Carolina is just kind of, no offense to her, but she's just kind of blah. And like I said, I've read a lot of books. I seek out information constantly. That's what I love to do. So for me, I couldn't find the answer to, like, if I just stop taking what I'm taking, am I going to deal with some crazy withdrawal symptoms? Because I've never taken 0.5 a day like I'm taking now, because that would cause me anxiety. But if that's not going to make me go into a seizure going down the road, then I'm just not going to take it next time I feel okay. And I'm going to go back to the way I was using it before, which was an as needed basis where I had a prescription for 3 years. Well, not that long, but you know what I mean?
Yeah. Dr. B, that's all you, man.
Yeah, just again, in general, it's a loan of dose. Number one, we won't know if you were going to let's pretend all I know is what I know about you. And if I was forced to say about somebody doing this, it's very possible you'd have some mild discomfort if you just stopped, everything. But I wouldn't do that, because that can be problematic, right? And I have to recommend, go to your doctor and tell them, hey, I want to cut this back to use it as PRN dose. But my strongest recommendation is sort out what the issue bottom line is and get on something much safer, even though your abuse potential, and it's still super low, your abuse potential, it's almost not even there. Just so you know, your dosing is nothing. Let me give you an example. The kind of people, abuse potentials I take care of, I have one, and I've had many of these that I take care of. I'm titrating this person off of 30 milligrams of Xanax a day, right? So I get kids like that 12 milligrams, 8 milligrams. Now, if you calculate the lie factor, increase it by a third, right? So they're probably, and meanwhile, there's opiates involved too. So 0.75 a day, I would definitely talk to your doctor. There's no reason to titrate back and not be able to titrate back, but ask him about cross-tolerating tolerance with a really low dose, maybe Klonopin, maybe Valium, maybe Ativan, and then look into other options to really get to the. I mean, you seem like a smart guy. Are you a vet?
No, I've been working in nightlife for 20 years.
Huh.
Yeah.
Yeah. That's yeah.
Unfortunately, I read a lot and I research a lot. So the amount that you're saying that you have some people taking, like I knew from day one because of the books that I read how it affected my brain and a lot of the things. Unfortunately, over the last 10 years, a lot of other things have come out about the medication. Yeah. And I was unaware that it was so identical to the effects of alcohol, which I've stayed away from other than pouring it for people my entire life pretty much. So
yeah, I consider it as alcohol in the pill. Parham, it's interesting he's saying that because gabapentin, doctors are still prescribing it, telling people, number one, they're using it off-label, and they're telling people, take this, it's non-addicting. And that's absolutely not true. And so we just, medicine is an evolving thing, and you got to really do your best. But yeah, that's I hope that helps, Isaac. I don't know.
I don't want to take too much of you guys' time, but I feel like I might have, other than, I had a pretty traumatic childhood, and that would take me paying somebody to go through that. But I have a variable that I feel like may be a partial cause of what caused me to even have to start taking it daily. And I'd like a medical opinion on if it's okay, if you have time, what you think about it. Would that be okay if I ask you and tell you variables?
Sure. Go ahead.
Okay, so 3 times in my life, because I've been in nightlife, I've had to be somewhat physically fit. I'm a little overweight right now, but 3 times in my life, I've gone on very, very strict fitness routines. And with that, very strict dieting. And all 3 times, I used a low carbohydrate ketogenic diet that was taught to me by a bodybuilder when I was 19 years old. The first 2 times that I did it and quit, I quit for the same reason that I quit this last time, which was severe anxiety, which led me to a long period of anxiety. And then I would slowly get better, and then, it would go away. But the first 2 times that I had these bouts, I didn't frequently use alcohol, but every once in a while I would drink, and I also abused caffeine. So the first 2 bouts with anxiety, I variabilized that it could be alcohol, it could be caffeine, it could be, a number of things. It could be the diet. And so I was like, I'm going to stop the diet, I'm going to stop caffeine, and I'm not going to drink it all. So the second time, I didn't drink it all, but I still use caffeine. So I was like, well, it must be caffeine. So a couple years later, I do keto again. Fast forward to about 1.5 years ago when this anxiety came on, plus the pressure of COVID, so on and so forth. I was on a ketogenic diet again, did not drink caffeine, did not drink alcohol, and the anxiety came back like crazy. Now, since that has happened, I've read some about how your gut being your second brain can be strongly affected, obviously, by your diet. And I will say that my diet did not have very much in the way of minerals from greens. So it was a lot of meat, a lot of quick, easy things with my, the job and nightlife. I didn't have much time to prepare stuff. So I ate a lot of meat, and I was wondering if you guys know anything about that and how that can affect anxiety and brain chemistry.
Meaning keto diet?
Ketogenic, correct.
Yeah. So I don't know of any data or studies. I could look it up real quick. and I wouldn't be able to give you an immediate answer. It's I've never, it would take a minute to look it up on my search engines. But in general, when they say the gut is the second brain or the first brain, sometimes, I won't even get into that. So I don't know. It could be very well known. And in fact, you know what? Give me a call or send me an email or contact Nicole. I'm going to look that up for you. And on my search engine,
Okay.
which are a little bit different than the way I read this stuff. And I'll check that out. But that's interesting to know. Do you know anything about it, Parham?
Not enough to be able to give professional advice in regards to nutrition. Nutritionists sometimes can be really helpful, man. The right dietitian, nutritionist can be really helpful. Someone wrote on the sidebar, exercise itself can be really stressful to the body when you excessively exercise. And when you started the whole thing off, though, for me, you said your childhood was just riddled and you had some trauma going on and this and that. I'm a family therapist, man. Everything that I do goes back to that and getting the source of that. Because I've known people that have worked in nightlife, and they weren't as adamant about their physical appearance as you have, like in terms of wanting to be a certain aesthetic, a certain look, a certain feel. So these are all things that are rooted in your mindset that were developed then and there. It's so that's where a lot of nuggets exist for you, Isaac, is finding out, doing that work. That work is really, I believe in it. That's my whole thought process, is that the power that exists in that work, because that transforms our futures, man. It really does.
Awesome. I really appreciate you guys' time.
Isaac, so use Nicole. I'll look this up for you, but send us a text. I want to know what you do with this. Let Nicole know. I'm curious how you do. You're a neat guy, and thanks for coming on. And,
I appreciate. I apologize. I don't know who Nicole is.
She'll find you.
Okay, perfect.
She's pretty awesome. Thanks for coming on. Subscribe to the channel. Check out Parham's channel as well, and I want to keep track of you. Okay.
All right. Thank you guys so much. Have a nice night.
You got it, bud.
Thank you. I want to ask you something, Parham. You mentioned, let me just tell the TikTok folks. Let me help. Tell the TikTok folks, guys, if you got questions, go on the YouTube, Dr. B Addiction Recovery Live. We are there. We can answer your questions. I just have this thing on and running. I'm on with Parham Namatola, and we're going to do this every Sunday. You said something about people, what did you say? The service industry, nightlife, and you were
Isaac was talking about the amount of external pressure that he put on himself because he was in the nightlife and needing to have a certain aesthetic or a certain look or a certain level of fitness. But I was saying there's people in that same industry that don't have that same philosophy towards how they look. So it's not really about the industry, but more about how you relate with the industry. And usually where our mindset and our outlook comes from is rooted not when we're there, it's previous to that. To have the expectations, the pressure. Hey, I need to look a certain way. And when he was talking about his history with anxiety and depression, I have a feeling that he felt those feelings long before he started working in the nightlife. But I don't really know Isaac that well, and I don't want to make that assumption.
I don't either, but just from the brief thing I had, he seems really introspective, self-reflective, very bright, and I'm kind of curious, and he seems like an entrepreneur as well. So I'm kind of curious. He kind of fascinated me. I'm curious how he got into that industry in particular, what his draw towards that was, because he seems like a self-starter. And again, just a really neat guy. He really fascinated me. So, and I won't make any assumptions either. I got to be careful. Very cool. Anything else we want to answer?
There's something there that Isaac said. A few people related with him. Isaac said that he's one of those individuals that's always in his head. He's a heady kind of guy. And there's one of my favorite bands, Tool. He has this lyric that says, "Overthinking, overanalyzing separates the body from the mind." So what I've been taught is this: as human beings, we develop in a moment by moment interaction with our environment. So if at some point in our life, our environment was in a way that we felt scared or we felt sad and we didn't know how to deal with it, one of the coping skills that we use is we go whoop, right into the thoughts. And we start to think and overthink and overthink and overthink as a form of not feeling. Now, this could be healthy because some people can become cognitive. Their cognitive skills can develop and they can use that in their different skills or different trades or different professions. But sometimes that also happens in personal relationships. instead of feeling certain things, we go straight to the head and we start to think our way through it. So this has nothing to do with Isaac. It's just he used that phrase that he's always in his head. And I know there's a lot of people, especially in substance abuse. I mean, as a clinician, I have so many human beings that sit in front of me and they can't get from down here to over here because at one point in their life, their emotions were too overwhelming for their ability to process them, and thinking was just a little bit easier to not feel.
Let me ask you this, actually. It's cool. I just made a YouTube a few days ago, and it was like, whatever, tools for recovery or something. And I talked, how to prevent relapses. And I said, well, usual person, place, thing, avoid bills. But I said, I want to throw something in there. Get the hell out of your head. So you're talking about it right now. But let me ask you this. Is this correct? I'm going to presume these kinds of mechanisms probably oftentimes occur in early childhood when you don't know how to process malignant or pathological presentation. And I'm not talking about 10 years old, 12 years old. I'm talking about 1 or 2 years old. And what is supposed to be presented to them, and they are supposed to process it so they can come up in an emotionally and cognitively healthy way. The shit is thrown at them. The rest of the world isn't doing that. They got to start going in their head. Is that a good way to think about that?
As you said, not 10 or 11 years old, and you said 1 or 2, I had my fingers up because I was saying 2 years old. In that moment, if let's say mom and dad are yelling or screaming and you're 2 years old and no one's coming down to tell you what's going on, to make you feel safe, to let you know the environment is okay, because the feeling's scary, it's an overwhelming sensation, kids start to go to their minds. There's a lot of kids in school, right? Like 4 or 5 year olds that daydream all the time, that they're just never inside the present in the room, is because, check this out. If our brain develops in a moment by moment interaction with the environment, if we're unable to pay attention to the environment because it's overwhelming and we go in our head, that's also happening at the same time that our brain's developing. So our muscles that are going to help us to tune in and pay attention when we need to, they're not developing. So when the teacher starts talking, the kid goes in la-la land. It has less to do with what's happening with class and more to do with what's happening at home and them not being inside their body and being inside their heads.
I want to throw some stuff back at you. When you sit there and really self-reflect on yourself and push yourself back to 1 or 2, you see how this shit develops. But now when you look at it on MRIs, functional MRIs, PET scans, social studies data on outcomes, psychology data on outcomes, substance abuse, which is all part of, it is so, it's so undervalued in terms of what is going on. And it's so critical because you nailed it. That brain is developing, and it's gonna develop by the Lego blocks that you give it that early. And in fact, Gabor Mate uses certain data, and he always says, by 3 years old, it's over. Today, whatever that means to the extent, I won't get into that. But do you know the stuff that you're talking about? We have pretty good data that it shows, starting from when you said it. If this is not addressed, these kids actually grow up with a smaller rate of brain size and development compared to their freaking peers. I can tell you, this is, let's say a mom and dad are not together, and one of them every single time, and they've never been together, every single time there's the exchange or something, and that kid automatically, the way it's for all kinds of reasons, loves mom dearly, loves dad dearly, and they have an intuition and a biochemical infrastructure that says that's mom and dad. And when one of them or both of them is just, even in your body language, even in your posture, if one or both of them are hostile to the other one or to each other, if they don't engage in a friendly way, incorporating a group interaction with the child where he understands that whatever is going on, this is okay, and they're not together, and it fucks the kid, it screws the kid up. Would you agree that these are, it's that level of detail all around, and even just parents at home yelling or not addressing the kids' emotional needs, which I mean even more when my parents are at home and the kid's sitting there at that age, they want your attention. And, I used to think even myself, well, let me wait till he gets a little bit older and I'll do math and science and statistics with him. No, whatever he's doing, doesn't matter if you guys are talking. He knows if you're looking at him and interested in what he's doing. And, later on, this will contribute to his development of his ego, sense of self, and meaning in himself. And it's that minute. Would you agree?
I beyond agree with you. That's the premise of everything I do is going back to then and there and finding out in retrospect and having some insight, gaining some insight, because later on in life, when people show up to us, Dr. B, as adolescents, young adults, a little bit older than that, they show up and they just don't understand what's going on. Sometimes the evidence, the proof is how the environment brought them up. Because what happens is every time in their current state, they experience similar feelings, similar patterns, similar triggers. It takes them right back to then and there. It takes them right back. I mean, there's people that don't understand why they have a hard time processing emotions because they never learned it when they were supposed to learn it. No one ever explained it. The environment never enforced it. And so now that's why the importance of having a really healthy and supportive environment in recovery becomes really important, because we got to relearn things that we might have never even learned before.
Relearn. Thank you. So I agree with you 100%. Yeah. So a lot of folks, would you say, are learning things for the first time? And it's almost double standard. I mean, double whammy, because they didn't get that feedback when they were during their developmental stages. And then depending on when they started using, things sort of really stopped there. So they got to go back to be, recover from using and also recover from the initial early childhood insights. Would you agree with that? Is that about right?
100%, man. I mean, I heard this quote that I love. It said the illiterate of the 21st century is not someone who can't read or write. It's someone that can't learn, unlearn, and relearn. Okay. Beautiful. Yeah. So our childhood, if we learn things in childhood that weren't serving us today, if they weren't helpful, if they're actually hurting us, we must, in recovery, learn how to unlearn all of those. And then once we've unlearned them, like the download's gone, we have to relearn them in ways that help us move forward in life. Sometimes we didn't get that when we needed to get it, but we're always evolving as human beings. So 10 years from now, this version of us watching this video right now is going to be a previous version of us, that if it gets what it needs 10 years from now, it's going to be able to function a lot more healthy. So we're constantly evolving, man. Constantly.
I love your saying that. Let me throw something else at you. And if you see questions, please go ahead. But I just want to see. I would argue that this also applies to folks my age, 40s, 50s, 60s, 70s. And the idea, let's say you get someone that's been, has had issues, both with substance abuse and the kinds of issues we're talking about for 25, 30, 40, 45 years. I'm going to argue that till the day I'm 6 feet under is an opportunity to learn, change myself, and grow. And that really hit home for me in my personal life in the last 2.5 years. Something was thrown at me that I had to really evolve and withstand. But now, from that personal issue, I would say my relationship with my team members is better. My understanding and empathy of others is better. And just my general cognitive growth at 50. And I'm a guy that, I'm pretty confident in who I am, what I know, what I believe. And it just really realigned me. So, and the data is clear. You can be learning up to 70s, really learning. Would you agree with that? And can you give me some thoughts on how you feel about that? It's not just younger folks, it's us oldies.
Yeah, I mean, it's like you said, till 6 feet under. And the fact that you, as someone with so much knowledge in a certain field, can come and say, hey, you know what? Despite of all that experience, knowledge coming from academia, training a lot of, future doctors, this and that, I came to the conclusion that if I want to continue to progress in life, evolve in life, I have to continue learning. That says a lot to other people watching this, Dr. B, because I believe that no matter who you are, no matter where you came from, what you got, if today you are not building on what you've learned yesterday, and tomorrow you don't build on what you're learning today, then you're just waiting, you're just existing, you're just existing. And by the way, that's a very dangerous place to be for people that experience substances, because when you don't have meaning in life, when you don't have purpose in life, when you don't have a sense of direction in life, who cares if you drink or use? Because you're not going to care. And trust me this, by the way, if you don't care about your own self, I know you might not believe this one, but neither do other people. I love saying this directly. I'll say it to the camera, is if you think that other people are going to care for your life more than you got to care for your life, it's a false presumption. Because check this out. When we get off this talk, you can see how much we're engaged. I listen. Dr. B listens. We're here every Sunday. We're here for you. We'll take your calls. We'll take your emails. However, when I get off this talk, I go off and worry about my life, right? I go take care of my family. I go do what I need to do. And in that moment, you're left by yourself. Are you going to put yourself first? Are you going to commit to discovering and recovering and evolving in your own life? If the answer is yes, you got a chance. If the answer is no, it's like, why not? And then when? When is that moment going to come for you? And I hope it comes right now, because I don't know what the heck's going to happen tomorrow. But right now, in this moment, we have the ability to transform our current circumstance. Our current circumstances have the ability to transform it the same way, doctor, you've been able to transform yours. And guess what? Not just your life, your entire team gets the benefit of that transformation. They go on in their lives, and they're also able to do what you're modeling for them in their own worlds and transform their worlds. If enough people take on this mindset, guess what happens? This whole damn world that we're living in transforms. And that's kind of what, call me a hopeless romantic, but that's why I live this life.
No, we're not hopelessly romantic, and I'll tell you why. The evidence is clear. And in fact, you brought up great points. We all benefit out of this thing we're doing, and I think it's going to grow. But you said something really good. So everyone's here right now. People might be feeling empowered. They feel good. People learn something. You and I learned quite a bit. But let me tell everyone out there, I'm going to walk away from this today and do exactly what Parham said. But again, outside of my professional life, there's always things that I'm been pig-headed about. And like I said, the last couple of years, I learned so much about myself and growth that it affects my professional life. I'm going to walk away from this with all of you here, with Parham here, what I got to be better today. And Parham, I want to say something to all of them out there. It doesn't matter your age. You can wake up any morning, any age, try again. And it's not about, I might fail again today at doing what I want to do with a new attitude towards life. But the nice thing is tomorrow is a new day and I can re-attempt. And you just keep doing it, guys. And the learning occurs. The mind will change, right? You don't have a choice. And you said something really good. You're going to go off and do this, this, and this. And I was like, okay, I should do it right and address all the shortcomings I have.
Absolutely, man. Yeah. By the way, I really want to say I appreciate the side chats going on. There's a lot of people that are supporting each other and helping each other through, giving a lot of encouragement. That's what community is all about. Some of us don't come from families of origins that might have reinforced love, support, care. However, what you're creating, this little community on the side, could be that for you. And that's the beauty of doing this on a consistent weekly basis. That's our commitment, to help you create this community that's going to help you in your recovery. And we could just be individuals that are there watching the development of it.
And I want to extend that to our TikToks, because when something is put out, I want people to start noticing the chats that start occurring and the comments that people make. That itself, instead of sometimes I can't respond anymore. And by the way, thank you for 150,000 subscribers, guys. But I can't respond to everything. But you guys are creating a dialogue which answers a lot of your questions. And Parham is right. The same thing could be going on the side. Parham, one of the things I want to do is as this is getting more and more, and it's going to build. We want to. Well, I don't know if we want to do that. We're limited time, but we've been on an hour and a half almost, I think, right? I don't know how we're going to do this. Kind of let it free flow. Kind of put limits on it. But for today, is there any questions you want to answer on the sidebar? Guys, do you have any questions? Because I want to let Parham and myself get to some stuff we need to do, patient stuff, some of it. But any thoughts on that, Parham? We can do whatever you want to do.
I just saw there's a few people that talk positive about EMDR, because I brought it up. Someone said,
if you want, scroll and put them up.
Yeah, so someone, I don't have access to put anyone up there.
Oh, Nicole, can you help? Let Nicole pop.
It was just a kind of a nice comment saying that in their recovery with eating disorders and addictions, it was something that they didn't find relief in. And I'll tell you this, there's a lot of big trauma programs in the United States, like the Cottonwoods of the world that specialize in trauma. They do use EMDR modality. The place that I'm at, we use EMDR as a modality for trauma. It's not for everyone. And that's what I always try to avoid. The cookie cutter approach is like, hey, this works for everyone. But it is something that's worth exploring if you experience trauma. Now, it's not to say, hey, guaranteed this works. The data might not be there. The research might not be there to say definitively this works for everyone or works for all cases of trauma. But there's enough people from their firsthand evidence of them speaking from their experience have said it helped them in their recovery, if that makes sense.
Yep, I've seen it, and I agree with you 100%. Give me 1 second. I got to bring water with me. I get this. Okay. I'm just going to grab that. I'll be right
back. I'll keep some of the chat going here. So the other thing, too, there was an individual here that spoke about they were an advocate for, marijuana use. It helps them in the recovery. I do want you to know this, that, hey, I opened it up today talking about the fact that not everyone's recovery is the same. So if someone comes from a 12-step abstinence-based recovery is zero use versus someone that has their own recovery, at the end of the day, whatever works for you works for you. The premise that I had is if you're in a recovery program, if you're in treatment right now, if you're seeking to get off of a drug of abuse, something you're addicted to, the use of marijuana while going through that process is something that's going to be detrimental to your treatment because, and if you didn't hear me in the beginning, it doesn't allow us to fully process our underlying emotions for reasons why we were using the substance anyways. And there's something that comes up. Hopefully this has some value to someone. There's something in treatment called someone having reservations. So when someone comes into treatment, they say, hey, I'm trying to get off my opiates. I'm trying to get off my cocaine, my meth, but I still have a reservation to use alcohol, or I have a reservation to smoke pot because I never really got caught up with those. I never really had a problem with those. I'll tell you what my general feedback and what my general suggestion is to someone who has reservations for using a substance when they're coming into the treatment realm. Again, if you're not going to treatment, you're living and using substances on your own, you're drinking wine, you're smoking some weed, and your life is fine, this isn't for you. This is for someone that's come to, let's say, for a heroin addiction, and they have some legal issues going on. They've dropped out of school. Their family doesn't trust them. They have no money. They haven't worked for 6 months. To that person is who I'm talking to, okay? If you have reservations to use, my general suggestion is always this. Write down with your clinical team or with a therapist, write down 3 to 5 to 7 to 10, whatever you want it to be, goals that you've been wanting and needing to accomplish in your life. Now, those goals can be in various different areas. It could be with relationship with others. It could be with your health. It could be with your employment, your education, your finances, whatever it is. Allow yourself with recovery, with abstinence, to do what you need to do. Talk to your medical team, talk to your clinical team, get the support you need to move forward in that journey. Accomplish those goals first. Okay? Accomplish those goals first. And then let the person who's accomplished those goals decide whether he or she still wants to drink, whether he or she still wants to smoke. Because if your reservation to smoke pot or to drink gets in the way of accomplishing those goals, you yourself rob yourself from the opportunity or the possibility to achieve those goals. I've seen it happen thousands of times. The same substance, maybe you're not doing opiates, but you're going to smoke weed and drink. and you do so, and Dr. B said in his clinical experience, and by the way, mine too, I've never seen someone thrive in life while they're smoking pot and thinking that they're gonna, get to a destination that may or may not exist. So allow yourself to achieve your goals first, then make a decision whether you want to drink or use or not. Because guess what? A lot of times I've noticed people, once they've gotten there, they have a little better self-image. They got a little bit more self-respect. They got their family back in their life. They got a job. They got people that count on them. Maybe they're back in school. They started tasting some victories for themselves. They look in the mirror and they actually like the reflection they see. That person says, you know what? I just did all this. I don't know if I want to smoke that weed. I don't know if I really want to drink. And then you set new goals at that point on. So don't rob yourself of that gift of just finding out what you can accomplish clean and sober.
Tell me this, something that doesn't make sense in my mind, because if you have a psychoactive substance on board, and no matter what people say, this is going to affect them, how are you even supposed to engage in groups and counseling? Think about it. You're telling me you are coming to counseling or group therapy it's not substance abuse, it's what that does to your brain, right? And what's been going on. How are they even engaging in these programs? Do you know? I mean, I pick things out, got kids out that are lit like a Christmas tree just on pot when they show up. And I'm like, dude, don't show up to the office stoned. You don't even know what I'm saying. But how are they supposed to do that? Tell me what your thoughts are.
Where I'm at, that doesn't happen. I'll tell you that. And even in private practice, by the way, if someone, not in a treatment setting, if someone in private practice wants to come to therapy, the basis of that is while you're going through this therapeutic process, you have to verbally at least commit the fact that you're going to abstain from substances while going through this process. If they say, well, I don't have a problem with it, well, you got to take the professional's recommendation that if you want to process your stuff, you're going to have to be away from substances. So they can't, man. If someone's showing up loaded, if someone's showing up on, stoned, just hit their pen, just smoked, and they're thinking they're actually doing some therapeutic work, they're actually not. They're just sitting in a seat and taking a seat, because we do need our mental faculties to share, to process, to receive feedback, to gain insight. That has to happen with a clear mind.
It's interesting. So that seems obvious with therapy, and they're showing up. But even at the medical office of what I do, which is an idiotic thing, really, you might be coming in for a script refill of subs or something, and you would think, well, two things. Number one, I do much more than that because I try to provide a really therapeutic environment my own way. But the other thing is this. Think about it. It's kind of funny. I always, when I catch it, I point it out to them. I'm like, dude, you're showing up to a doctor's office, an addiction doctor's office, stoned. Think about how insane that is. And I let it go a few times, whatever. But that there's a degree of insanity there, right? Or a cognitive dissonance about an issue you may be having.
Absolutely. It's when you're dealing with addictions, you want to allow yourself to go through the treatment process, trust the professionals like yourself, trust professionals like myself, saying this is the way you need to do it. If you're experiencing discomfort, if you need support, if we need to revisit your care, let's have a discussion about it. Let's find out what's going on with you. Let's find out what's causing you discomfort. Don't just go using the pot. I mean, these facilities that allow that to happen, it breaks my heart, man. It breaks my heart because they're robbing people. People are coming to get better, and they're saying, we don't really care for you to get better. We just want you to stick around long enough to be able to go to a few groups and kind of, say we're doing the gig when we're really not doing it. It does a disservice for the industry. It really does.
Yeah, I agree with you. Hey, I just saw somebody on here that I find interesting because I keep, sorry for putting you up here, the Caring Farm D.
She's had some very good feedback, by the way. I believe she's a pharmacist, and she wrote a few good comments regarding the possible interactions between co-occurring, comorbidity of mental health and certain medications with marijuana, so she's talked about some good stuff inside.
So since you said that, that's what's been catching my eye, except I think I see her all over the place. And I think, I don't know, but that's what I saw the Caring Farm D, and I remember that she's always had great feedback on the different channels. Hey, if you'd like, I'd love it if you pop on here and say hello to us, Caring Farm D. I just want to a meet and greet, as they say. Let me see if we got Nicole on here. Hi,
Hey, Dr.
Nicole.
B. Hey, guys. I
up,
just
Nicole?
wanted to talk about medical marijuana with you guys for a second. So we all know that I'm a hardcore drug addict. I was addicted to meth, cocaine, oxys, IV, anything, Xanax, all that. And for the last 5.5 years, I've been able to stay sober using Suboxone and abstaining from all other drugs. Well, just this last year, I started toying with the idea of medical marijuana, like bouncing it back and forth in my mind, especially for whenever I tapered off of Suboxone and jumped off. So I took it upon myself to order some gummies. Well, the gummies came in and I took them. I told everybody on my YouTube channel about it. And I'm going to tell you this right now. They were amazing, but I was stoned out of my mind and I felt so good. I was so happy on them, but I could totally find myself using them every single day to go through life and not actually going through life clear and open, clear-minded. And as much as I enjoyed having the energy to go outside and play with my son, and it was like, the only way I can explain it to you guys is that when I have to make myself get up to do things, I have to push myself every single day to do and it might not seem like it from the outside looking in because I'm on my channel, I'm making content, but I have to push myself to do things like take a shower, make my bed, drive my son to school. And I was just looking for some kind of relief, something, anything, and I tried it for that week and it was amazing, but then I hit this reality in my head and I was like, I can't do this because I'll just be stoned all the time and I won't be able to be of service to anybody. I won't be able to help anybody because I'll just be stoned all the time and leaning on marijuana to live my life. And then I won't learn how to live my life without it. You know what I'm saying? And so that was a hard reality for me to realize that I'm just an addict to everything. And the reason why I do so well on Suboxone is because it doesn't produce a mind altering euphoria. I've been on it for so long and it's stable in my system. And so I can't lean on it to check out, to not feel. And so I think that it's really important if you're someone who's going to try medical marijuana to be at a point in your sobriety where you've been sober for years and you can actually identify and say, you know what, I'm screwing up. I'm going to use this marijuana and I'm not going to be present. I'm not going to be able to actually heal and work through things in my life because I'm going to be using it in not a therapeutic way, but an addictive way. And that's what it would do for me. And that's why I can't be somebody who utilizes medical marijuana, because I will literally turn into a stoner hippie child and never do anything. I'll be eating 6 pizzas a day and y'all will never see me come out of my house because I'll just be stoned floating on air. But I just wanted to share that because I think a lot of people in the recovery community they're like I am, and they're looking for relief. They're looking for something to help them because they've tried everything. And it's kind of depressing to think, am I never going to be able to find relief? Am I always going to be like this where I'm looking for something? And I do work. I work hard on my mental health. I process everything. I'm extremely outspoken. And it's just the saddest feeling to feel like, will I ever be able to be normal again? Will I ever be able to have energy? And I'm not talking about meth energy. I'm talking about just the simple fact of wanting to get up and get out of bed and do everyday life. You know what I'm saying? So that's all. Sorry about that.
I have some, Parham, if you have something to say, go ahead. I just have a little quick thing to say.
Go for it.
Oh, the only quick thing I have to say is you are absolutely right. And this is about gaining tools without having the the euphoric stuff on board. But there's something else that I want to point out here. It's not even just saying, hey, I'll be going through life on a substance, there's so many issues we haven't pointed out here because there's a variable here from a formal perspective that is not being calculated. Over time, will using this stuff lead to back to leading other stuff, increasing the use of this stuff, the harmful effects of whatever, however way you're taking it on. So that's another consideration. And that was the only thing I wanted to add. And yeah, you're right. What you're really getting at is, can I cope with life stresses on life's terms in my own capacity? But I think, Parham, please, I'm sure you have a...
Yeah, thank you, Nicole, for sharing all that. You know, that it takes a lot to say that, especially being in recovery, because you know, there's a lot of people that'll put some shame and stigma and all that crap that comes with it about a story like that. Obviously, you know, Dr. B and I don't think we don't subscribe to that line of thinking. Each person is their own unique story, and that's a part of your story. And it's going to help a lot of people, because just on the sidebar, it looks like some people, they understand, they feel you, they've been there. And I'll tell you this is the phenomenon that you were talking about, Nicole, about am I ever going to feel good without it? Or am I ever going to feel normal? Or am I going to feel like the energy I'm looking for to get out of bed and have vitality and joy and vigor and all that kind of stuff like that? That's not a substance abuse related phenomenon. Human beings that are just watching this, or maybe not watching it, just living, they're struggling with the same stuff, right? People, even without substance abuse issues, have a hard time finding the motivation to do all the things they need to do on a regular basis. All people, even without substance abuse problems, when they feel stressed out, they look for something external. You happen to look for maybe the pot or the weed. They look for something, whether it's shopping, whether it's sex, whether it's food, whether it's spending. That's what we do. We feel inadequate. We're programmed to feel inadequate. We're programmed to feel like we need more. We're programmed to feel like we need something else to feel normal. And then we get it. And what happens? We're like, okay, now what, right? Because guess what happens with pot? And I'm not saying for everyone. There's a few people on the side chat saying, hey, it doesn't have to be that way. You can use it differently. You know, they've had a different story. But for you, this is what happens in your case, right? Let's say you use the substances and you use the pot and you get a little bit of an echo. It's bothering me a little bit.
Oh, sorry.
It's okay. So when you use the pot, what happens is this. Let's just say that you continue using it, right? And you get that relief and you get that energy and you get that joy and you feel better and you're the hippie, like you call it, 24/7 smoking. When life on life's terms happens, when something happens in your life that tests you, right? God forbid something happens to a loved one. God forbid something happens to work. Something just happens in society. And all of a sudden you're smoking pot, but that pot alone isn't enough to help you feel good, to feel better, to feel whatever. Because you've already engaged in that behavior, the odds of you reaching for something else, right? Going back to certain drugs of use, and this is what Dr. B sees in his practice, the odds of those people going back to their drug of choice is higher than the person who is not using a substance and uses non-substance forms of coping with their anxiety to be able to handle that. So you kind of cross a bridge with that. And this might not be true for everyone, but for you, it sounds like it was. So the best thing you did in this moment was, hey, realizing, having good insight, saying that this is not for me right now, because I can see myself, like you said, getting addicted, getting dependent, getting hooked. Because if that happens, all it takes is one life event for you to say, you know what? I'm not getting the energy I need out of this pot to get out of bed to deal with my kid. I'm still depressed. I know what's going to help me. And based on your story and what you've shared, there's a few substances of choice that you've had that help you get the energy that you need to get through it. So it's individualized, man. I'm glad you were able to go through that and not lose a lot of the progress you'd made. You've actually gained something out of that. I think we lost her right now, but I know she's watching. So yeah, that's just stories like that really help, guys. Stories like that really help because people need to know that there's multiple different ways to the recovery process. It's not just black or white, sober or loaded. You know, it's not binary. It's not this or this. You know, it's individualized and unique for everybody.
Parham, I was just thinking your feedback you're giving, and in general, it's so awesome to do this with you because your feedback is so kick-ass. I just love it, man.
Thanks, Doc.
That's why you got the reputation you have in town. You're just really good at what you do, and you have such a deep and broad understanding of these things. It's awesome, and I love it. Nicole, she's gone. Okay, John. Okay, Nicole, no problem. Anyone? Let's see if there's anyone. Let's see. How come Caring Farm D won't come on? Is she afraid of us? She keeps putting these great things on. Here's her. You see anything? Well,
no, just some people asking how long these usually go for. 2 hours seems to be the consensus so far. Some people saying they're using pot for pain, in that regards, and that's just, it's case by case again. If someone's using medical marijuana, like an indica strain or something to help them with their pain management, that doesn't mean that anyone can do that. Someone might have underlying mental illness. They might have predisposition to schizophrenia. They might be taking certain medications. They might just be sober off of opiates. It's case by case. So I appreciate people's individualized stories on the side, because that's your truth. And like Dr. B said last week, how do you know if this is good or this is, hey man, whatever helps you in your life, whatever brings quality of life to you, whatever helps you move forward in life, that's what sounds like it's good for you, in terms of that's not causing pain, destruction, damage. It's not hurting you. It's not hurting others. So we're all for that.
Absolutely. And as far as how long this goes on, like I said, we're going to figure this out and decide how we want to do this, and whatever you guys respond to. Parham, I have this comment from T. Michelle, and I'm wondering if T. Michelle, are you willing to come on and ask this question? Because there's a reason, Parham, and I'll explain to you why we're on here. If you're willing, Michelle, to come on to yeah, that's what I thought. So this kind of started on, Michelle, it's not about you having a problem. You have a question. And since you have a question, I'm happy to answer it. But it's one of those questions that's a little bit tricky to answer. And I will give Tal Parham a little bit of history and everyone on, ever since I started doing this on TikTok, Parham, I get every one thing I put up, I get these questions about chronic pain patients not getting their medications and how I feel about that and why do I promote Suboxone and so forth. And the sense I get, and I don't know, I could be wrong. That's why I was going to have Michelle come on. One of the things is that the questions most of the time, and I'll pull one up next time, are not really questions. They are more like they'll say a bunch of things that are not the case and ask you to respond to that. It'll be like, given the fact that A, B, C, D, and E, what do you have to say about that? And A, B, C, and D sometimes are just not the case. There's presumptions and assumptions and a formal presentation of something. And, it seems a little bit, and Michelle, if I don't mean to put you on the spot, but you asked the question, and then your follow-up question was kind of along that line. It was a little defensive, and I don't mean to offend you, but you asked a question, and I can give you a response since you're here, and I've been wanting to do this for some time. So I've noticed that, and I don't know what it is that's going on, but I can say this. So if anybody of that group of people that put up pain questions that I can't respond to for multiple reasons, one, the question itself is loaded. We used to call it metaphysically loaded. It's loaded with 15 other questions and too many assumptions and presumptions that, I'm not going to answer. But if you have a genuine question, I will give you a response to this kind of question. I don't know if you see what's been going on from my perspective, Parham?
Yeah, I think in general, and I don't know this person, but in general, I think when people ask questions to professionals like yourself, or have some sense of an authority or some sense of knowledge about it, there's a disconnect there, because people forget at the core is that we're just people. Like if you just have a direct conversation with us and ask about what it is you want to ask and talk about your needs, and you can see how patient we are. You can see how patient Dr. B is. Like, we'll actually hear out all the point of views. But however, they feel pressured, they feel stressed, they feel it's difficult to communicate with professionals. Doctor, it's like it's always been around. I've always noticed that people have a better chance explaining themselves when they see patience, when they see compassion, and which is what me and you model every single week here. So hopefully by us modeling how we listen to humans, they become more courageous and have the desire to show their face here and have questions with us. Because here's the thing, whatever question you have that you're having a hard time articulating and saying, and those loaded questions you're talking about, it will help out so many other people that might have that exact same question. And to watch how Doctor goes through that process of helping you clearly understand what it is you're trying to say, and there's nothing that we can't talk about in this space. We're really,
if there's, and I think if there's an indictment of the, that I'm part of this conspiracy to cut off pain medications and push something else, I don't find that offensive. I've been called much worse. But I think the way, you guys are coming at it doesn't address the question or the issues. So, Michelle, like I said, I'm not meaning to pick on you. I just all of a sudden saw one of those pop up here. And I always tell those that I see on TikTok, if I have a second, I'm like, I can't really answer your question. So if you want to come on, if anybody of that nature wants to.
There's something William just wrote right now. He said, what should one do when they have a very strong psychological addiction? Oh, you got it. Psychological addiction to hard drugs, for example, oxycodone here, but manage to avoid a constant physical addiction. My answer to that would be this, is I believe that the mind and body are highly connected. I don't see them as two separate entities. I don't see the mind and the body as two separate forms. We're connected. And when someone is psychologically addicted to something, that means their thoughts are consumed with it. Their thought, they think about it. There's pre-contemplation with, they're thinking about it when they're not around it. How am I going to get it? When am I going to use it next? How's it, all that kind of stuff. And that is a form of dependence. That is a form of addiction. And by the way, when we're addicted, even psychologically, to something that is addicting, like oxycodone, it does show up in other areas of life. So you've been able to not have a physical dependence on it, per your words, but psychological dependence is right up there from my perspective. And that also a good addiction specialist would be able to distinguish that and would be able to treat that. So they wouldn't, yeah.
I'm curious, Parham. He's calling it a psychological addiction, and he's trying to get into addiction specialist. So I would love it if William came on and told us a little bit more. Isn't that interesting? So is that what he means, where he's thinking about it all the time, or he uses it and then can walk away without having any addiction or any withdrawal?
Yeah. He clarified it in this. He did a follow-up comment right there. Thanks, Will, by the way. We appreciate you engaging with us. The second one that he wrote, he's able to use it for a period, but then he gets off it for another period. So when he shows up to addiction specialist, he's not being considered. They won't accept him to the clinic because he doesn't have a physical addiction. So I guess what type of clinic we're talking about there matters. Is it a clinic that's for, that you're more familiar with, doctor, or is it a mental health outpatient clinic that, because just the fact that you're showing up, that you say you want some help for something that you're using is enough, by the way, to say that, hey, we can help you, or we could treat what it is you're saying. Because that a verbal, expression of your symptoms, just talking about what you're going through is enough to help with a clinical diagnosis. So it doesn't always have to be, hey, do you have a physical dependence? Do you have substances in your urine right now? If you're saying I've had a challenge for years, and I get obsessed with it, I get addicted to it psychologically, but then I force myself to get off it. That's still a pattern, an addictive pattern, by the way. There's addiction within that pattern that needs to be addressed.
And in fact, Parham, you know what? You hit a bunch of things on the head. With William's thing is cookie cutter. Okay, if this is this. But my suspicion from what William's saying is he's probably going in trying to get on subs, and they're looking at him like, dude, you don't qualify, and it's very possible that he very much does. And in fact, I start people on subs that have been off of substances for 2, 3, 4 months. But I bet you that's what his thing is. He'd be interesting. Hey, if you're in California, William, and you don't want to come on here, give us a call. Kind of curious what the deal is here, and we'll help you out. Kind of interesting. Here's another one of him. He's dribbling pieces of information for us as we're.
Yeah, he's good. He's helping out.
Yeah.
You're doing it, Will. You're getting there. So at the very last one, Doc, he said he actually doesn't want the subs. He just wants the counseling. So since counseling is the counseling. So I'm assuming probably insurance is getting in the way here and this and that. But, like I said, in order to diagnose with someone with a substance use disorder and a severe substance use disorder or a moderate substance use disorder, if you go look that up, you'll see that, physical dependence to the drug is only one of the 11 of the necessary requirements for diagnosis. So even if someone's not using heavy amounts of substances, but wants to get help for counseling, as you call it here, you definitely qualify, because I have a feeling you've been doing this for a while. So again, maybe you're not talking to the right people. Maybe you need some help. You need some help finding the appropriate resources. But that's my best that I can give you with the limited information that we have from your comments, Will.
Check it out. And poor William, he even used to have a issue of 130 a day, and they still won't take him. That's odd. Huh. Wow. And he doesn't even want subs. That's odd, huh? Don't you think so? Yeah, it might be insurance.
Yeah. And there's people on the side chat talking about addiction is a mental illness. Yeah, I mean, it's diagnosable, all that. Oh, he lives in Sweden. So there's a we forgot we got an international audience, William. That's that's a little different. I'm not too familiar with maybe that's something that I do need to learn. But I would love to dive into, maybe just send us a message, man. I'd love to learn how the healthcare system is in Sweden when it comes to addiction like this. I need some more education, to be honest with you.
Yeah, if you want to send, so you can either send it through email. I think our emails is Parham's emails up. Either one of us. There's even if it's for Parham, I'll connect you to his whatever email it is and forward it to him, because that is interesting. And I've had a couple of people. Some Northern European countries that have the same issues. I see Kat on there. Hi, Kat. How are you? Nice to see you. What else?
I would say if as doctors looking for a question to pose, if you guys have any questions or any topics for future weeks, if you're interested, if we get a consensus of what those would be, that would be also good too, because we do like it to be user driven and hopefully add some value that you're actually looking to get. So
absolutely. What's the best way to do that? I think it's is it in the community thing where Austin knows how to put up polls and stuff like that for this kind of thing. And we can start it right. And this goes for you guys on TikTok as well. If you go to the YouTube channel, Nicole and the rest of the team know how to set that up, Parham. And they in the community section, I think, of YouTube. And it's questions and polls and stuff like that to have topics of discussion. There's many ways where we can evolve this so it's a lot more user friendly for them, and we can maximize utility. Ask Austin and he can set us up for that. And I'm looking at some of this. Neon. Interesting question. I'm going to defer the answer because I will be way too long-winded. But short answer is not in the near future, or at least creating dependence, because I would say buprenorphine is one of those things. Let me see what else we got. Nicole, do you have anybody that's crazy? Okay. Look, everyone's kind of like, what the heck? He can't even get into mental health, which is odd. Do you see anything? We got to also get you, Parham, to be able to.
I mean, I have access to reading them, but I can't put them up though.
Yeah, I want to have you be able to do that. Oh, he's talking. I'm sorry. You know anything about turmeric? It's kind of the talk of the last 10 years. Everyone's on turmeric. You know anything about it?
I personally use it. I personally use turmeric in my juices with carrot juice. I use turmeric on like spices on food. It's anti-inflammatory. So a holistic way of using what ibuprofen, for example, could be. But it's not for, you got to try it, just like everything else, find out what people are using, give it a try for yourself. If that's appropriate, talk to your provider. But it's a holistic way. I've been using it for a while. We use it in Persian cooking too. Yes, we do.
Nice. Yeah, I like it too. Yeah. But I don't know the data.
Yeah, I don't know the data either.
Does Suboxone work? Oh, look, Kat. Yeah. Does Suboxone work? Yes, it does, Roughneck. Hey, guys, on TikTok, I see the numbers growing here. We start this every Sunday at 1:45 p.m. YouTube channel, Dr. B Addiction Recovery. Myself and Parham. It's a pretty cool ass show, and we I think it is. And Parham is amazing. We answer questions. You can get on here, and we've been going at it for a little over 2 hours now. But it's every Sunday, and for now we're kind of coming up with a topic. But we veer away from that, answer whatever you want. We really want to get out there, support you guys, educate you guys. And that's what this is all about. I think we're sort of winding down. Can I answer this for Amanda?
Absolutely, yeah.
Methadone and Suboxone are fantastic medications. They're both real maintenance medications. Methadone was discovered much earlier than Suboxone. Suboxone in the 60s, 63 or 67. Different mechanisms of action. Methadone is much longer, but safer. But here's the only thing I will say on that. If I was going to just sum it up and separate the two, it's this. Probably a lot more people that are on methadone can be on Suboxone. Methadone is more dangerous to use and abuse. It is more difficult to get because you got the liquid handcuffs. It is a much more complicated and complex medication to manage because of its pharmacokinetic and dynamic properties and bioavailability. And in fact, I run a methadone clinic in Hollywood, so I'm very familiar with dosing and so forth. So my answer to methadone is great medication, but for a very certain set of the subpopulation. And I like both of them. That's all I have to say. I think there's videos and stuff on it. Where are you from? Iran. Let's see. Do you see anything? I want to catch as many questions as I can this last second. Yeah, Bradley, we will. We're working on it. The answer is yes. They do. Parham, have you seen serial abuse?
I have seen serial abuse. Yeah,
quite a bit. Yeah. Caring pharmacy, we want to see up here. Cat. You see anything?
I mean, this is a good question. It's a long-winded answer, but I could try to do a quick one for it.
Sure.
My wife is an addict and I'm an addict. I want to get clean. Can I still be around her if she is using? Obviously, you could still be around her. It's just very difficult. That conversation needs to happen. I've noticed in treatment, in recovery, in sobriety, when two people are side by side facing the world in the same direction, they have a lot better ability to actually get to where they're trying to get to. But there are people, I've worked with people that, one spouse got sober and the other one didn't. It's difficult, man, because what happens is if you're clean and sober and you're off your drugs and she's still using, we know how it's like with temptation, especially when it's inside your house, especially when you see it. You know, you see the eyes, you smell it, you feel it around you. All it takes is one bad day to say, hey, just give me that. You know, the ease of access is a lot higher. And then also when one person gets sober and the other person doesn't, it causes some resentment sometimes. It causes some expectations sometimes. It causes a lot of conversations that are really tough to navigate through. There's a lot of blame, finger pointing, all that kind of stuff that happens. And the relationship dynamics change. So every relationship is set in a certain dynamic, is a certain ebb and flow that it has. When you change one, it changes everything. So then just be prepared to know that the relationship you're in with someone, that's when someone's clean and sober, someone isn't, that it's going to be a whole new relationship. And sometimes people get sober and they look at their significant other and say, ooh, or vice versa. You know, they look at them and say, I don't know if I want to continue doing this. So there's a lot that happens there. I would strongly suggest, if you're going through that process, get professional help, get a third party, unbiased individual to be able to look at your relationship from the outside, to be able to give you objective guidance, feedback, suggestions, someone that knows addiction, someone that knows family dynamics, someone that knows marriage and family therapy, especially if there's children involved. I mean, this is a very loaded question. I wish we could have spent 30 minutes talking about it. And by the way, is it RJ? If you ever want to, maybe in future weeks, pop up top, you know, get your face on here. We can answer those questions for you. That's what this is for. And, you know, keep it up, man. Keep moving.
Parham, this has got to be odd because, you know, let's say two people are using together, and let's just use opiates, and they're married and one of them wants to get clean. It's just, to me, it just seems so complex because you got to go back to the early thing of their relationship. Tell me what you see, because did they get together when they were using? Did they know each other before they were using? What was the dynamics and the construct of the relationship built on which edifice? The user or the clean person or the PTSD, complex PTSD? You know. So what do you see? This is brutal. And I know another cell gimmick, a lot of treatments was couples rooms and stuff like that, which there's no evidence for that. And in fact, it's usually disastrous. Please educate us on your thoughts on all those. And we'll start closing, but this was so good. And I really want your thoughts.
Yeah, well, that was a great way to look at it because it is more complex than what I just said. And the other thing, too, is this, is if two people in a relationship are both using and one person wants to get sober, just know this, that there's a third person in that relationship. That third person is the drug. I know drugs are inanimate objects, but each person has a relationship with that drug, right? And sometimes the whole relationship, the premise, the foundation of it is actually weighed, is scaled on that substance use. The amount of time you use together, the emotions, thoughts, and feelings you have while under the influence of the drug. And it's like having like a third wheel almost. Right. So when one person changes, when I say the dynamics changes, it changes the whole ecosystem of that relationship. And then a lot of times so someone said boundaries. When you choose to get clean and sober, you got to say, hey, I'm accepting all of the different possibilities and the impact that this decision can have on not only my relationship, but by my marriage, for example, and all that kind of stuff like that. So that's why I'm saying it needs professional help for sure. You know,
thanks. Yeah.
When can I get that question answered better? Well, hopefully we did a good job trying to answer it. But if you want to get a little bit more personalized approach, I don't think we got the time today, but come back, RJ, come back and talk about your actual personal experience with this. You know, we do this every single Sunday at 1:45 Pacific Standard Time. So if you come here, you can, you know, the link will be out there for you. And all you got to do is just click on the link and join the conversation. And we can, you know, not give you direct therapy, but give you general feedback and information about, you know, what to expect going through this process.
And Parham, I just keep seeing these really cool questions, even on TikTok. I keep telling the TikTok guys, you got to go on here. It just catches my eye. Baclofen, gabapentin, all this stuff. So guys, come on here. I think we are, hi Aaron. I think we are getting pretty close to, we're closing up for today. Every Sunday, 1:45, rain or shine. Different topics. This will develop as we get feedback from you guys. Parham, any closing thoughts?
No, this is great. We're getting more comfortable doing this. As you can tell, we're both highly passionate and committed professionals to this. So the more the community grows, the more we're all going to grow together. Grateful to be a part of this, Doc.
Absolutely. Hey, guys, thanks for coming on. We'll see you next Sunday. You guys know how to reach out to us. Parham, thanks again. This is awesome. And I learned so much with you joining me. And this is fun. We'll see how it goes. Guys, feedbacks, okay? I guess we're going to sign off.
Yep.
Which I don't know how to do. Should I just end broadcast?
Yeah, end broadcast. Yep.
Okay, I end broadcast. But you're going to still be on, huh?
I don't know.